morning and welcome to the ISSADA podcast, where we feature some of our esteemed stockists and also industry experts in beauty. Today we're blessed with the presence of Dr. Mark Doyle, a plastic surgeon with 30 years experience working here on the Gold Coast in sunny Australia. Mark specialises in facial and body plastic surgery and has quite a unique take on the way in which he prepares his clients for surgery. So we're going to talk to Mark today. Hello, Mark. Thank you for joining us.
Thank you, Deb, for inviting me.
It's lovely to have you here. Let's start at the beginning, shall we? What made you go into medicine to start with and then plastics? Are you from a medical family?
No, not at all. I haven't any doctors in the family at all. I had a friend who was, he was about 16 at the time, had an epileptic fit, which is weird, but I found it really difficult to try and know what to do. So medicine sort of came from that. I just didn't want to be in a position ever where if somebody was unwell, I couldn't help them.
Wow.
So I did medicine, and I did that at Monash University. At the end of medicine, we have to make a decision as to whether we become a GP, a specialist of some kind, and the specialist can either be in the surgery field or in the medical field. I'm a sort of person that I like to do something, get a result. So surgery appeals to me. So if somebody's got a ruptured appendix, you take it out, people get better. I'm not the physician type person where you prescribe people tablets and then you see them every few months to see if they get better. I'm much more, and I do a lot of I like doing things with my hands, and surgery was just the obvious thing for me to go into. So I started doing my surgical training, and during the surgical training you get the option of doing different specialties. And I was doing general surgery at the time, which is things like gallbladders and hernias and appendicectomies and things like that. And one day I had to assist a plastic surgeon, and the plastic surgeon came in and did a breast reduction on a lady. And the thing that I found really amazing with it was halfway through it looked terrible, but at the end of it looked great. And it was just an operation that required obviously a lot of skill, a lot of knowledge. But it was like sculpting a body, and it was I was really impressed with it, and I thought, this is what I want to do. In plastic surgery, you do operations all around the body. You're not limited just to doing feet or fingers or hips or whatever. It's a total body thing. We do operations on every part of the body, which I again found more interesting, and was, I guess, what made me wanted to continue in that field.
And am I right in saying that plastic surgery is one of the specialties with the longest training period?
Yeah, that's true. There's only 2 or 3. Plastic surgery, neurosurgery, cardiac surgery are the main fields that take the longest to go through, and are obviously just a bit more detailed in the training process.
And how many years does it take to go through that?
You finish your medicine after usually around 5 years or thereabouts. You then go and spend a couple of years in the hospitals just being an intern. You then get into a surgical field, and if you want to get into plastics, that can take maybe 2, 3, 4 years, maybe never, to get into the plastic program. And then it's about 5, 6 years after that. So add all that up, it's a long time.
Wow.
Long time.
Wow, that's some dedication, isn't it?
Yeah.
And I think that's a really interesting point, because not many people know that. You're particularly well known for facelifts, so I've seen some great work that you've done. We've seen, quite a lot of your clients. How many would you say, or how many total surgeries would you say you've done?
Well, that's a good question. On my books, I've got over 100,000 patients. We don't count, so I couldn't tell you exactly how many I've done. But over that period of time, because I've been doing it for so long, you meet people when, children having a cleft lip, and you see them later on and they have a nose operation or whatever, and it goes throughout the family. And families often follow their surgeon. So if you see somebody in the family initially, and then 5, 10, 15 years later, somebody else in the family wants something done, then they often come and see you because there's a sort of a connection. So I couldn't tell you the answer to that, but
a lot.
A lot. Not every patient I see needs an operation, but I see a lot of people that have several operations over the course of 30 years. So it's a lot.
And of course, over those courses of years, I mean, very much in the early days, there was a bit of a stigma about plastic surgery. It would be secret women's business or secret men's business even. And now it's become more commonplace and more acceptable and spoken about. How's that changed the way in which your practice operates, or in which, in the way that you manage that? Is the demand got greater over the years?
Well, as you say, it's been a really big change from people being really secretive, and now social media, people are putting, you can get online and find out what operations people have done, the celebrities have had done, who the surgeon is. It's just gone crazy from one extreme to the other. I think it's better before the social media, to be honest, but that's the way it is.
Yeah, do you think the social media gives people unrealistic expectations and perhaps makes people more self-conscious?
I think so. I have a problem with social media because I had one of my staff members that was in her 20s, really pretty, and she couldn't send a photo of herself without modifying it or editing on before she could send things. And it sort of gets to the stage now that what you see online, is it real? Isn't? Who knows? Is AI involved? Who knows? It's a completely different thing, and people have got very high expectations these days of what they want to look like.
Yeah. And I think as AI gets smarter and smarter, more realistic looking, you will have no way of knowing. I think wasn't there a case last week in the newspaper where a social media person, the filter she was using slipped and she lost all her followers. So one of the things that we talk about on the podcast is, what it's like being in business. So doctors have the choice of being employees of a hospital, whether it be private or state or another organisation, or owning their own business, which you have done for many, many years. What made you go into business for yourself?
Well, I had an interest in the cosmetic side of the business. And the cosmetic side of the business is not done in the public system. So for that reason, I had to do basically most of my work in private. The first few years I was doing operations, hand surgery, things like that. And I became more, as time went by, I went down to just doing the cosmetic work, as I say, which is purely a private thing. It's not a public hospital at all.
Business is hard. Have you found business hard? Running a business, like being in the business?
Absolutely. We learn to be doctors and surgeons. We don't get taught how to run a business, but we have to. And you learn by your mistakes, I guess, over that period of time. If I had to criticise the whole medical business from a business point of view, they should have had a lot more training in how to run a business, how to look after staff, all the things that go along with the business.
And we were speaking a little while ago. You were telling me how you've changed the way in which you prepare your patients for surgery, specifically for facial surgery. Can you tell us a little bit about that?
Well, anything that helps the quality of the skin is a good thing to do. We're very conscious of the sun, so protection of the skin with sunblock, etc., is really important. Because I do a lot of facelifts, I see a lot of ladies that have had varying from people that have had good skin care for a very long time, and people that have had none, people that have kept out of the sun, and people that have done the exact opposite. And the quality of the skin will affect the quality of the end result with the facelift, because the facelift is basically an internal skin tightening type procedure. But if you can tighten good skin that's on the outside, then you get the better result. So we've been really keen to make sure that we keep an eye on people's diet, how they're managing their skin before. We have a pre and a post-op pack these days for people with their skin care for for people having particular facelifts. It's just made it's a good thing to be doing.
Yeah. And you also, when you mentioned that doctors don't do any business or business training at med school, I also believe they didn't do a lot of nutritional training either. So you get your clients to have supplements before surgery to improve their skin health. How did that come about? What made you decide to do that?
Well, we've had multiple different sorts of skin care ranges in the office, and that's usually the decision we often make is when we see a patient that comes in and says, "Hey, look at my skin," and you go, "That's amazing. What are you doing?" And we get some advice from them. Obviously, we go it's the plastic surgery thing now is much more orientated towards all sorts of treatment with respect to beauty, and in the conferences and things now we have a lot more education based on the different sorts of skincare available and what's the best for the sort of operations we do.
And obviously you haven't always been an ISSADA customer, you've had other brands before, but what made you choose ISSADA?
I had a lady come in one day and I was really impressed with the quality of her skin and asked her what product she was using and where did it come from, and went from there. I've been happy since.
Excellent. And for our viewers, Dr. Doyle and ISSADA have collaborated together to come up with a pre and post surgery regimen for his clients, which is also available online. And that was quite an exciting project to work on as well, wasn't it, Mark?
Absolutely.
And then on the supplements, I know you get your clients to take supplements orally as well. What do you recommend for that?
Well, again, we go back to people that are experts in the field. We had a biochemist and people that are specifically involved in nutrition, and we follow their advice and have done for a long time.
Fantastic. Yeah, well done. Going back to what you said about doctors don't have training in business at med school, what advice would you give to doctors coming through now who are thinking of going into business for themselves?
I think you've got to go back and say there are people that are trained to run businesses and have business degrees and people that don't. And my advice is you need to don't try and run a business by yourself. That's not what you do. You do the operations, you're the doctor. You need a team around you of people that are capable of handling a business, and it's probably no more complicated than that. But the mistakes that the doctors make is they try and do it themselves because we think we know everything, and it just doesn't work.
And it's incredibly stressful being a doctor as well. So to take on extra stress and responsibility.
Yeah, it doesn't make any sense to distract yourself by doing things that you don't know well. Get somebody else to help you.
And Mark, tell us a bit about you personally. So what do you like to do when you're not operating? What do you do to release the stress and the pressure?
Good question. I enjoy photography, so I travel quite regularly. Landscape and portrait photography are things I'm interested in. I do the editing and I do the printing of the photographs and things myself. So I enjoy that. I enjoy video. I play quite a few musical instruments, and I've played in bands and musical things over the years, and that's been another sort of passion. So I've got plenty of things I do outside the medicine.
And what instruments do you play?
Guitar is my main one. I'm currently learning the harp. And I play some mandolin and some banjo and things like that as well. Fabulous.
Well, thank you for coming to talk to us today, Mark. It's lovely to see you. And I hope our fellow ISSADA team will all enjoy hearing your story. Thanks.
You're very welcome. Thank you for the invitation. I'm much appreciated.